over at St. John's, and I'm here with Rob in our oncology unit, who has the opportunity to see both sides, from the provider side as well as the patient side. But we're going to talk about the patient side because he recently underwent knee surgery. So we're just going to talk a little bit about that.
Okay.
Before we get into that, tell us about the pain or some of the symptoms you were dealing with in your knee.
Well, it was just progressively got worse. It was a kind of a sharp pain. I could deal with it. I could walk, but over about a 5-year period, it finally got to the point where I said, I've got to do something about this. And that's when I called
Sure.
your office. So,
how is it affecting you functionally or professionally or athletically?
I wasn't able to. I wasn't able to run. I wasn't able to do any sports that required any lateral movement, it was getting harder to go for a hike, do something like that with my wife.
Mm-hmm.
So it just got to the point, and I got tired of people teasing me at work saying, you're limping. So I said, okay, I got to do something because I'm tired of people, saying, why are you limping?
Yeah.
So finally, after about 5 years, I called your office.
What kind of things did you try prior to surgery for the knee?
Boy, I didn't have a lot of swelling, so I didn't do much icing or anything. Really, I would occasionally wear a brace,
Mm-hmm.
but that didn't do a whole lot of good. So really, I didn't really do much of anything as far as
You
treatment.
just toughed it out.
I just toughed it out. Yeah.
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 And then was there a specific event or was there a specific trigger that decided it's time to take care of it?
It just was a cumulative thing. It just got worse and worse, and finally, it was just even walking across the street was hurting. I mean, it got to that point where just something as simple as that, and I could tell it was, bone on bone. And I actually then had an X-ray, and I think originally I thought maybe it wasn't bone on bone, that I had a meniscus tear or something. And then when I found out what it was,
Saw the X-ray.
I saw the X-ray, and that's when I decided to go forward.
Being in the medical profession yourself and knowing about this, can you talk a little bit about what your fears or hesitation about getting your knee fixed were? Because you held off for a long time.
I did. Well, part of it was the expectation that I would be out of work for a long time.
Okay.
So that was kind of a worry.
Sure.
And going through what I thought would be a major surgery. Those were probably the two biggest things, and a cost, and that turned out to not be too bad at all. Since I work here at Providence, it worked out pretty well.
Good.
Yeah, so that all worked out great.
Talk a little bit about your experience in recovery. It's been about 8 weeks now.
8 weeks. I do want to say one thing. I didn't let the people know when I came in for surgery that day that I was an employee of Providence.
Sure.
The care I got was tremendous.
Yeah.
From pre-op to the recovery room, to spending the night, the respiratory therapist, the imaging tech that came to do the ultrasound.
Sure.
It was unbelievable. The care was so good. I was just thrilled.
Okay.
And I felt good going home the next day. They got me walking right away.
She
I think it was that evening.
Right.
They actually had me walking and even doing some stairs and walking with a walker.
Right.
We got a cane, and I really hardly even needed the cane when I walked out of the hospital. I mean,
You went home the next morning.
I went home the next morning,
Mm-hmm.
and I really felt pretty good. I used the cane just a little bit the first day, and I started doing my rehab exercises that they gave me, the paper. So I did them pretty much on my own.
Mm-hmm.
And I think that was really important because I was very diligent with trying to regain that range of motion.
Sure. That's the work of recovery.
Yeah, and it came back fast. I mean, I was bending my knee well past 90 degrees within a few days.
Good.
So it was remarkable. I mean, I was walking unaided without any cane or walker. I would say by the second day.
And when did you come back to work?
I was only out 2 weeks.
And how did you decide it was the right time? How did you make that decision about when to return to work?
Well, first off, I felt good enough. I didn't really need to take a lot of pain medication. That was one factor. I took, mostly it was to help sleep, because I did have some aching at night
Sure.
when I was sleeping.
Mm-hmm.
But the pain during the day was not bad at all. So I kind of, I wanted to make sure I was off pain meds before, I was driving to work.
Mm-hmm.
And so that really, within just a few days, I would say I stopped taking the Norco.
Mm-hmm.
And I was just the prescription for the aspirin and that, over-the-counter stuff like Aleve and that type of stuff, that seemed to work just fine.
Mm-hmm.
So I think it was the just getting off the meds, and my pain tolerance was okay.
Yeah, I've seen you walking, because you always walk to work.
I do.
Yeah,
I have a long walk. Yeah.
What was harder than you expected it to be about recovery?
Probably the only thing would maybe be figuring out how to sleep comfortably.
Yeah.
So I experimented with pillows
Sure.
between my
Yeah.
legs, and that was something that took a little while to get used to. But it was all positive. I mean, it was everything went better than I anticipated. That's what I can say.
Having just been through this, you're actually still going through this right now,
Right.
because it's only been 8 weeks.
Right.
What advice would you give to patients about dealing with post-operative recovery?
I would say I was diligent about icing.
Icing,
I did that frequently during the
ice
day.
bags, ice packs, ice machine,
both,
everything.
Both. Ice bags. I even, my brother's a coach, and he said, get a big bag of peas.
Yeah, frozen peas.
Frozen peas worked great because
Sure.
it just kind of molded around your knee.
Yeah.
And so I did that, and I was icing, probably 4 times during the day.
Mm-hmm.
I was doing my exercises. I got the range of motion back pretty fast because of that.
Mm-hmm.
So I think those were the two. And then I being kind of competitive, and I grew up as an athlete, I pushed myself a little bit, and
Sure.
not too hard, but I wanted to recover fast. And so I you have to get beyond a little bit of that pain to,
Yeah. I saw you in the parking lot yesterday, and you told me that you're hiking and back to golf.
I got back to golf 6 weeks. I played 18 holes. Took a cart, but still there's a lot of walking
Sure.
involved even when you're taking a cart. I've played a few rounds of golf with no pain in that knee at all, and then went for a hike up to Mescal Canyon with my wife on this last Saturday. It was about a 5.5 mile hike up some fairly steep terrain, and no swelling whatsoever when I was done. So I couldn't be more.
Oh, okay. And again, Rob has always been athletic, so results may differ. Yeah, that's great.
Yeah.
You walk very smoothly now. It's really nice to see.
It feels so much better.
What would you tell patients as they are trying to deal with their arthritic knees, having been through this now?
I would just say, get it checked, sooner. Don't postpone it.
Mm-hmm.
And just don't be afraid of it. And I would tell them to call your office, because my result came out just great. I think you did a fantastic job. So that's all I can say.
Yeah, it's easier because we work in the same hospital.
Yeah.
Okay.
Yeah.
Well, thanks so much for sharing.
No problem.
This helps so many people.
Yeah. Thank you very much.
Yeah, that's right.